3, 2, 1. Good afternoon. This is Dr. John Bennett from Miami, Florida, broadcasting for Larkin Hospital TV. This is the first show in the surgery channel. We have the pleasure today of having Mahmud Awadallah MD from Greece, and he's going to talk to us today about laser surgery. And we're also joined by Shajish Kurakosi. He's he's a teacher at Larkin Hospital in the Neurosciences Center. So first we'll let Shajish introduce himself. Hello, Shajish. Unmute yourself and introduce yourself.
Oh, hi everybody. My name is Shajish Kurakosi. I'm a head and neck surgeon, maxillofacial, and currently I'm working as a faculty in Larkin Health Science Institute. I'm glad to be here today, and we have this wonderful talk from Dr. Mahmud, and nice to have John, and welcome everybody, and thanks for having me on the panel. Thank you.
Okay, well, welcome, Shajish. Okay, Mahmud, welcome.
Yeah, thank you, Mr. Bennett.
Could you just tell? We'll start off by just talking about your background a little bit. Did you grow up in Greece, and did you go to school in Greece as an undergraduate?
No, I grew up in Jordan. I finished my high school in Jordan, and after that I attended medicine in 1976 in Romania. I finished my medicine in Romania. After that, I made my specialty in Athens, Greece. And since that time, I work in Athens. I am doctor surgeon, general surgery, specialist in general surgery. And I am a consultant surgeon in the health center in Athens. The last 10 years, I practice laser surgery.
Oh, 10 years.
Yeah, for cosmetic surgery especially.
Okay, did you have to formally train for that, or you just did a lot of practice in that field?
No, it's just from practice.
Okay, just experience.
Experience, yeah.
Okay, 10 years of laser.
Yeah.
Wow, are you getting, are there more indications for laser now than before? Are the indications expanding for laser surgery?
Yeah. The technology is going on every day, and I follow all the updates.
Okay, very good. Okay,
So,
today you're going to talk about xanthelasmas.
Yeah, Xanthelasmas.
Okay, well, very good. Okay, it's all yours, Mahmud.
Yeah, Xanthelasma is a skin lesion known as xanthoma too, but generally this lesion is known as yellow plaques or yellow patches.
Okay.
It's from their color. So, what is xanthelasma? The typical lesion appears as soft yellow plaque around the eye. They are made by cholesterol deposition in the skin. Xanthelasma normally is a sign and not a disease. Xanthelasma is more common in Asian and Mediterranean populations. Most people with xanthelasma are middle-aged or older. It is more common in female than males. Despite the fact that these lesions are considered rare in literature, we noticed an increase in their incidence in the last 3 decades. Once someone gets xanthelasma, he has to take in consideration 2 questions. First, is it harmful for me? And second, what should I do? Usually these lesions aren't harmful, but if you are bothered by the way they look, there are treatments that can get rid of them. even though xanthelasma itself won't hurt you, in 50% of cases, it could be a sign of a serious underlying systemic disease, such as hypercholesterolemia, heart and vascular disease, liver disease, and hypothyroidism. What should I do when I get such a lesion? Once you get it, don't ignore it. So you have to consult your doctor to rule out any underlying disease which may produce the lesion. Xanthelasma usually won't go away on its own. The growths will either stay the same size or get bigger over time. If you are worried about your appearance, you may want to have them taken off. So what treatments are available to take these lesions off? And here is the point. Before discussing the various treatments, I would like to highlight an important point of the lesion. Xanthelasma is not only the yellow plaque which we see by our eyes. There is an unseen, I repeat, there is an unseen deposition of cholesterol under the skin around the lesion, This point is very important to be known and treated so as to minimize the rate of recurrence of the lesion. A variety of treatments are available. Including medical and surgical treatments, such as lotions, various types of lotions, skin peeling, laser therapy, and even surgical excision of the lesion.
Did you want to share slides, Mahmud? Or?
Yeah, I will.
Okay.
Are we on the slides now?
Not yet. Not yet.
Not yet. Sorry, but it is my first.
That's okay. That's okay. There we go. We see it.
Yeah.
There we go.
Okay.
Cause.
Okay. Here are the causes of the disease of the lesion. Because, as I said before, the lesion is not a disease; it's a sign. In 50% of cases, as I said before, must be investigated to see if there is any underlying systemic disease. So, about the causes. And the incidence of the causes is about 50% of cases. The other 50% of cases, there is no any reason. Okay, it's harmful. It's harmful, such a lesion. About the causes, about half of the people with xanthelasma have high cholesterol, which means that the patient or the patient may have very high levels of LDL cholesterol, which is the bad cholesterol, or very low levels of high DL, which is the good cholesterol. Other causes are the liver disease, and especially we are talking about the biliary cirrhosis. This disease arises or can raise the cholesterol levels. Other causes are hypothyroidism. About the treatment, as I said before, xanthelasma usually won't go away on its own. These lesions must be removed by the doctor. There are a variety of treatments. Your doctor can choose the treatment which is suitable for you. These treatments include laser therapy or laser treatment, surgical excision, freezing or cryotherapy, medical solutions or lotions, and electrodesiccation. The modality which can be used from your doctor depends on the size and the location of the lesion. What we have to keep in consideration that the region is small. These lesions usually arise in the inner corner of the eyelids. So we don't have a lot of skin to sacrifice. Surgical excision have a high recurrence rate, about 40% of cases in the first year. It may left a scar, so the cosmetic appearance is not acceptable. The lotions and chemical peels are not strong enough to destruct or to destroy the lesion. They will need a lot of sessions, and the results are disappointing. So we consider that laser treatment is the treatment of choice, and we prefer the CO2 laser for vaporization of these lesions. Majority of patients only require one session only. For those patients with large lesions, all covering almost the whole of the eyelid, more than one session may be recommended for safety and best results. With CO2 laser, xanthelasma can be removed by layer by layer, down to the muscle. The underlying tissue contracts, leaving a significantly smaller defect than the original size of the xanthelasma. Keeping in mind that, that a deposition may be present under the skin near the seam lesion, we can vaporize these deposits under the near skin, preventing the skin intact without damaging the nearby skin. It's an important point not to sacrifice a lot of skin and not to make deformities in the region. This is why results with CO2 laser are much more acceptable with minimal recurrence rate, which is from 10 to 15% of cases. If you have any question, I don't know if I make good presentation. Dr. John?
Yes. We can see it fine.
I don't know if it's fine. You can make a montage of the video.
Okay, the video. You want to show the video?
Yeah.
Oh, do you have the video?
Yeah, of course I have the video. I will show it now.
Okay. Sometimes this works well, sometimes it doesn't. But let's try it, and yeah. I'll let you know. Yeah, we can see it okay.
Mm-hmm.
It looks good.
Looks good. Here is a case. He's a male.
Okay, very good. I hope
a female of history. Yeah, as we can see here. Here is the xanthelasma. You see, yellow patches, yellow plaques in the inner side of the eyelids. Here is the laser. The procedure is done under local anesthesia. As you see, the patient doesn't feel anything. We remove the lesion layer by layer. Here we can see the results after 10 days. And you see the location, and here it's about 3 weeks later. You see nothing is seen without any deformity without any scar. That's it.
Okay. Okay.
That's all.
Yes. Is it moving okay?
Yeah, yeah.
Okay. Okay. Now you're off the screen share.
Yeah.
Okay. Very good. Okay. Can we ask some questions now, or are you done?
Yeah, I'm done. If you have any question.
Yeah, sure. I'm sure Dr. Shajish Kurikoshi has some too. That's a relatively small device, the laser. I somehow pictured this to be a bigger and connected to a machine. But it looks. Is that portable?
No, no. It's the handle of the machine only.
Oh, okay.
Yeah, the machine is portable machine. It's about 60 by 50 centimeters.
Oh,
60
okay.
by 50. Yeah.
Okay, so it's not
It's a small
portable.
machine. It's a portable machine. The thing that you saw in the video is the handle of the machine only.
Right. And you can do this in your office. You don't have to do it in the hospital, right?
You can do it in your office, and the patient leaves immediately without pain, without hemorrhage, without risk of infection.
So no anesthesia.
Local anesthesia is used. Yeah.
Local. Oh, local. Okay.
Yeah, yeah.
And you do no scalpel work. It's all laser.
Excuse me?
You do any suturing or cutting?
No,
with
no, no.
Scalpel?
No, no. No suturing. We leave the trauma open and it heals by itself quickly. After laser surgery, it heals very quickly.
Okay.
So the downtime is very, very short.
Okay. Okay. Shajish, do you have questions of Mahmud?
Oh, yeah, yeah. Hi, Mahmoud. That was wonderful. Yeah. Yeah, as a head and neck surgeon, I'm probably the old school who, try to excise these lesions. And as you rightly said, the recurrence is very, very high. And then somebody, one of our ophthalmologists, he started using the cryo for laser. And I'm sorry, for Xanthelasma. And he was very pleased with the results. How would you compare cryo with laser?
Yeah, cryo it needs one more session, a lot of sessions.
Oh, okay.
Yeah, it is. It has a good result, but the recurrence rate is too high.
Oh, I see. All right. So it's just like surgery.
Yeah.
What you said, the recurrence rate is higher with cryo?
With cryo, yeah.
Okay.
So would you say that laser has the least recurrence rate?
Yeah.
Okay.
Laser has the CO2 laser and argon laser. Two lasers can be used there.
Mm.
They are very effective and with good cosmetic results.
And what is your recurrence rate so far?
I have 13 cases. From the 13 cases, I have 2 recurrences rates only.
So out of 13, you have 2 recurrence. So we're looking at 10%.
Yeah.
Okay. Yeah. Okay. Yeah. That's surgery has got a higher recurrence rate. What other complications have you come across?
From laser?
Yeah.
For about 2 to 3 months, we can see pigmentation, hyperpigmentation.
Oh, okay.
Okay, but by the time it leaves. it goes out. It is just for 3-4 months.
And are the patients unhappy?
Yeah, they are very happy.
No, regarding the pigmentation, would they be very unhappy during that period, or?
No, we tell them from the beginning that we may have pigmentation, hyperpigmentation in the region. But it is not matter for them. You know, seeing that yellow thing is taken off, they are very
happy.
Yeah.
And what about the the skin color? Like, would you find any difference in Caucasian or a pigmented skin? What would be the difference?
We see that the region which was vaporized with laser more darker than the rest of the skin.
When you said that there is pigmentation, but in a fair skin person, would the pigmentation be less, or is it more or less the same as a dark skin person?
No. Pigmentation has to make with the type of the skin and the thickness of the skin too.
How would you correlate?
For darker people, it is more. For darker people, we can see hypopigmentation and not hyperpigmentation.
Right. Okay. And is that a problem?
It's not a permanent problem. No.
Oh, so it's only temporary, even in the dark skin.
It's temporary.
Oh, I see. Right. Good. And what's any infection rate?
Infection? No, nil. Nothing at all.
Nothing. Right.
No.
Okay. Excellent.
Typically, Mahmud, these occur around the eye region. Typically, they occur around the eye.
Yeah, on the eyelids.
On the eyelids.
On the eyelid, and most commonly in the inner part of the eyelid.
Oh, okay.
But we have seen some cases and under the eye, and almost all the upper eyelid was with xanthelasma.
So you have to be very careful since you're so close to the eye.
There's no any problem. We can protect the we protect the eyes.
Oh, okay. You do that with drapes or some kind of covering, or how do you do that?
Covering, goggle. There's a special goggle for that, and there is special lenses. We can put lenses on the eye.
Oh, okay. I guess you must know about that, Shajish, too, right? Protecting the eye.
Oh yeah. We normally protect the eye when we are doing some kind of procedure around the eye, because you don't want to touch the cornea. But laser probably has got more sophisticated protection for the eye. I mean, I generally put a shell into the eye and just protect the eye with a shell. So basically, I'm using a scalpel, and I don't want to slip and go into and touch the conjunctiva. So my protection would be like a basic precaution, that's all. But laser would be probably a little more. And what I use is probably I've used a small little metal, thin, contoured metal thing for protecting your eye. But probably for laser, you have to have something which does not react at all.
Okay.
Yeah. We use plastic lenses.
Oh, you use a plastic? Is that how you protect the eye?
Yeah.
Oh, okay, yeah.
Plastic lenses, yeah. It's like a lens on the eye.
Oh, it's like a lens, correct. Okay, that's good. Yeah, that makes sense. Yeah, you can't use metal when you're using, but I normally use metal because I'm a knife-happy surgeon, so.
Well, Mahmud, you said you've been doing this for 10 years, correct?
Yeah.
Now, do you see it increasing? I think you mentioned before the show that you said it's increasing in the amount.
Yeah, there's in the last 3 decades we see an increase in the incidence of the lesion. It's not so uncommon as mentioned in the literature.
Oh, okay.
And maybe because as I said before, the lesion is more common in Asian and Mediterranean populations, and I live in Greece. It is a Mediterranean country, and Jordan is an Asian country. So I am in the heart of the problem.
Okay. Well, in Miami, we're in kidney stone capital. So I guess every region is famous for something.
That's right.
Now, do some general surgeons still do it with the old-fashioned way, scalpel and excision?
Excision, yeah.
Or everyone does it by laser?
No. The cosmetics. A lot of surgeons do the typical old way by excision the lesion.
Right.
But because the skin is limited in this region, you can't sacrifice a lot of skin. So sometimes you cannot remove all the lesion. Right. That's why the recurrence rate is very high in surgery.
Right. Well, I imagine scarring is something you need to be concerned about.
And scarring and deformity.
Right.
You know, if you take a lot of skin here and you have to suture it to close the trauma, you will ectrope the eyelid. This means that you will take it up.
Okay.
Okay. But if the lesion is linear, is very small, we can incision it without any problem. But when it is more than 4 millimeters in diameter, I think laser therapy is that treatment of choice.
Okay. Very good. Shajish, do you have any more questions you want to ask Mahmud?
No, it was wonderful. Yeah, just perfect. And I stopped doing the knife surgery because of the recurrence rate. Actually, I stopped it very early. I always refer it to somebody who does either laser or who does the what do you call the freezing. Yeah. I stopped it very early. Cryo. Yeah. I stopped it very early. I just did maybe 50 cases, and then after that, I saw the recurrence rate was a bit high, and that wasn't acceptable. But I must say, one of my patients, he came to me, and because I took a sliver of skin, and the guy had a blepharoplasty. You know, he had an eye job done for free, so he was very pleased. He had this little skin which was hanging from the upper eyelid, and he was very happy. He told me, "Thank you very much for doing that also for me." I said, "Okay, you're welcome." So that was something incidental. Yeah. Anyway, thank you.
It is recommended, Dr. Sajish. It's recommended that when you remove the lesion by knife, to make an incision for blepharoplasty.
Yeah, exactly.
So as to minimize the deformity and the scar.
Correct. Yeah. That's what I was.
I want to ask you a question, Dr. Sajish. You asked about the cryotherapy.
Yeah.
Do you have cases treated with cryotherapy?
No, Mahmoud, I don't do cryo. I was saying that I refer the cases to our ophthalmologist. He was doing cryo. Yeah, he was doing. So I don't do cryo. I just send it to him. Actually, there was a skin guy also, a dermatologist, who was also doing some kind of cryo there. So they both joined together, and I was happy to let them go ahead with it. They are the experts. And,
did you follow up those patients?
No, I don't. I was actually the chief of the unit, so if I normally have a check on the recurrence rate, and I found out that their recurrence rate was far less than mine. So I told them, yeah, you guys take over. and do it. So that's the way I dealt with that situation, and it was very acceptable for all of us. So that's how it went. Yeah.
Okay.
Okay, very good. The first show for the Surgery Channel with Mahmud Awadallah, and I hope he becomes a fixture in this channel. And thank you, Sajeesh, for coming to commentate. It was good to have another surgeon. Well, it's been a while since I've done scrubbed in on any surgery. I was one of those guys that just held their retractors. but it's certainly educational for us to see the world of laser surgery with xanthelomas.
Yeah.
So, okay, gentlemen, thank you and good night.
Good night.
Good night.